Okay, so another question that's commonly asked is how long do you treat these conservatively in a splint? And there's a difference of opinion, but in my practice, typically for the soft tissue mallet fingers, you're going to treat in a splint a little bit longer than the bony mallet injuries. And the reason being is that bone heals back to bone quicker than soft tissue reattaches back to bone. So we'll start with the bony mallet here. The bony mallet injury, I typically will treat 2 months in a splint. 2 months full time in a splint. And what happens, the way it heals, is scar tissue will form between the little bone and the main bone here. And you won't see that for usually up to 8 weeks after the injury. And that scar tissue then will actually calcify and turn into bone, and you will have that main piece connected back to the small piece. Oftentimes you will end up with a little bit of a bump like that, so it won't heal perfectly flush like this. There'll be a little bit of a bump there, but usually it works really well. The soft tissue mallets you treat usually for 3 months in a splint. Again, it's a little bit slower healing time. After the full-time splint period, whether it's 8 weeks for the bony mallet or 12 weeks for the soft tissue mallet, then there's a period, a weaning period, where you slowly wean out of the splint, increasing the amount of time out in the splint over the course of a couple of weeks, keeping a close eye on the finger and looking for a lag. And if it slowly starts to lag, then you need to go back into the splint full time. So we'll wean out of it over a couple of weeks, and during that period, if it lags, we go back in full time for a couple of weeks and then start the wean process all over again. And usually I'll do that with a patient for a maximum of 4 to 5 months, which can be a really long and frustrating road for the patient. So oftentimes the patient will dictate how long we perform that weaning process. But usually after a few months is all you need to treat these.